Hello, I'm Dr. Laukkanen, and I'm going to be making a few comments about partial breast radiation. And thanks very much for joining me. So, breast radiation can either be given to the whole breast, which is the standard technique, or a specific area of the breast can be targeted, and that area is the place around which the cancer originally was found and where the lumpectomy was done. Here's an example on the left side of partial breast radiation. And you can see a volume that ends up being, say, the size of a plum or perhaps a very small orange, and multiple radiation beams converge to create an area where high energy X-rays deliver energy, and most of the breast tissue around it is spared or has a fall-off dose of radiation. And if we look at this picture instead, where the whole breast is treated, you see a radiation beam entering from one side and from the other, and they essentially cover the whole breast. And so the partial breast radiation is suitable for some cases of breast cancer. And as you can imagine, looking at the picture on the left, if a breast cancer has what's called multiple foci, or a bunch of little spots, as opposed to one single spot, that's not a good idea to use partial breast radiation. And although different cancer centers vary in their uh, measures for what cases are appropriate for partial breast radiation, in general, it's for people over 50 who've had one smaller, less than 3 centimeter detectable focus of cancer in the breast, and where, when the lumpectomy has been done, there's no cancer right at the edge. And there's a type of breast cancer which accounts for about 10% of them, called the lobular type. And because these have a tendency to be able to track more widely in the breast while being undetectable, they're typically not included either. And then there are a few other, if you will, fine print conditions. The time schedule for partial breast radiations is often the same as what's used for whole breast radiation. For example, if there are going to be 5 treatments of the whole breast, the partial breast radiation can be typically delivered in the same number of sessions. And this references where we use standard external beam radiation. That's radiation coming from a machine, as opposed to where radiation sources are placed into the tissue for a period of time, so-called interstitial radiation, or where there are special devices used to deliver radiation right at the time of surgery. If we look at results, where studies have looked at patients with follow-up of, say, 10 years or so, we find that for patients that have been properly selected, that the chance of having cancer come back in the breast when partial breast radiation is done is essentially the same as when the whole breast is done. And a typical figure might be around 4% at 10 years. Side effects of whole breast and partial breast radiation can be seen while the treatment is in progress or shortly after, or a substantial time afterwards. The thing that's noticed in the early going is skin changes. And as you might imagine, as there's less overall skin exposure to radiation with partial breast, those skin changes are typically going to be over a smaller area and less noticeable. In the long term, both types of treatments can cause a small amount of scar tissue to form in the breast area. And in whole breast radiation, as you might imagine, it's quite uniform. In partial breast radiation, it's focused in the area where the treatment is given. And sometimes that can give some localized distortion of the breast. Whenever that fibrous tissue forms, there's always the potential to have some more tissue fluid and some tenderness, but many people don't find that a bother. So while a lot has been learned about partial breast radiation, there's still much to be learned. There are active clinical studies, and if it's something that you may be looking at, you might be invited to participate in one of these active clinical studies. And thanks very much for your attention.